If you stopped having morning erections even just a few times a week, your heart may already be sending you a warning signal you've been completely ignoring. Think about the last time you woke up and didn't have one. You probably didn't think anything of it. Maybe you were tired. Maybe you'd had a stressful week. Maybe you figured you're getting older, these things happen. But here's what nobody told you. Your body wasn't just having an off morning. It was trying to tell you something about what's happening inside your arteries, inside your testosterone levels, inside a system that, if it starts quietly failing, can lead to a heart attack years before you ever feel a single chest pain. The blood vessels that supply an erection are some of the smallest in your entire body, as narrow as 1 to 2 millimeters in diameter. And according to research published in the Journal of Sexual Medicine, erectile dysfunction is a stronger predictor of cardiovascular disease than smoking, high cholesterol, or family history in men under 60. You read that right. Stronger than smoking. So if your morning erections have gotten less frequent, less firm, or have disappeared entirely, your body has been waving a red flag at you every single morning. And most men wave back and go make coffee. And that's exactly what we're going to break down today. I'm Dr. Lena, a board-certified urologist with over 10 years of experience, and I've personally evaluated and treated more than 5,000 men for exactly this issue. If you haven't subscribed yet, hit that button now, because the information I release every week is the stuff your doctor simply doesn't have 15 minutes to explain during a checkup. Every single morning, while you're still half asleep, your body runs a silent diagnostic test on your cardiovascular system. It's called nocturnal penile tumescence, or NPT, and it happens 3 to 5 times per night during REM sleep in healthy men. This isn't about arousal. This isn't about desire. This is your nervous system and your blood vessels doing a scheduled maintenance check, pumping blood to penile tissue to keep it oxygenated and healthy. Think of it like your body's version of a hardware self-test. Here's the medical fact that stops most of my patients cold. The arteries that supply blood to the penis are roughly half the diameter of the arteries that supply blood to the heart. So, when those small vessels start to narrow due to plaque buildup, high blood sugar, or inflammation, the penis shows symptoms years before the heart does. One of my patients, I'll call him Marcus, 44 years old, fit, ran marathons, came to me because he'd noticed his morning erections had basically disappeared over about 18 months. No chest pain, no shortness of breath. His cholesterol was borderline, but nothing alarming. We did a full workup, sent him to cardiology. He had significant coronary artery disease. The cardiologist told him if he hadn't come in when he did, he was looking at a heart attack within 3 to 5 years. His morning wood saved his life. But here's where it gets really scary. That cardiovascular early warning system only works if you actually pay attention to it. And most men are trained from adolescence to either be embarrassed by morning erections or to completely ignore them. Now let's talk about the hormonal side, because this is where it gets complicated in a way most general practitioners don't have time to explain. Testosterone isn't just the sex drive hormone, it's a master regulator. It influences your red blood cell production, your bone density, your mood, your metabolism, and critically, it plays a direct role in maintaining the health of the smooth muscle tissue inside the penis. Low testosterone doesn't just reduce desire, it actually changes the tissue itself. Here's the stat. According to the American Urological Association, approximately 40% of men over 45 have clinically low testosterone, but fewer than 5% are ever diagnosed or treated. That's tens of millions of men walking around with a hormonal deficiency affecting their heart, brain, bones, and sexual function, and they have no idea. I had a patient, 38, athletic build, no obvious symptoms, who came in primarily because his wife had noticed he seemed depressed. He'd lost motivation. He was sleeping more. And yes, morning erections had basically stopped. His total testosterone came back at 187 ngdl. The lower limit of normal is 300. He wasn't getting older. He had hypogonadism, a medical condition that had gone completely undetected for what was likely years. And most doctors will never tell you this. A single morning erection, firm and lasting more than a few minutes, is actually one of the most reliable non-invasive indicators that your testosterone is in a functional range. Not perfect, but it's data your body is generating every night for free with no blood draw required. Here's a question I ask every male patient over 30. How often are you waking up with a morning erection? The answers I get range from every day to I can't remember the last time. And then, almost without fail, the men who say almost never follow it up with, but I think that's just normal for my age. It is not normal. It is common. Those are two very different things. A healthy male between the ages of 20 and 60 should be experiencing nocturnal erections 3 to 5 times per night, with morning erections most mornings. The frequency does decline gradually with age, but a sharp decline or complete absence at any age under 70 is a clinical signal worth investigating. I want to tell you about a man I'll call Daniel, 52 years old, came in for a routine checkup. When I asked about morning erections, he laughed it off. "Doc, that ship sailed 10 years ago." He'd normalized something that was never normal. When we ran his labs, he had type 2 diabetes that had gone undiagnosed. High blood sugar had been silently damaging his autonomic nerves and blood vessels for years, and the loss of morning erections had been the first symptom, ignored for a decade. This next part is what shocked even me when I first saw the data. In a landmark study published in Circulation, one of the top cardiology journals in the world, men with erectile dysfunction had a 49% higher risk of cardiovascular events compared to men without ED. Not 5%, not 10%, 49%. Your morning erection is not a joke. It is a vital sign. This is the part where I stop being gentle because this section is actionable and I need you to actually hear it. The 4 biggest lifestyle destroyers of nocturnal penile tumescence are things you are almost certainly doing right now. Number 1, alcohol before bed. Even 2 drinks in the evening suppresses REM sleep, which is the exact sleep stage when NPT occurs. Less REM, fewer nocturnal erections, less tissue oxygenation, faster deterioration of erectile tissue over time. Number 2, chronic sleep deprivation. A study from the Journal of the American Medical Association found that men who slept fewer than 5 hours per night for 1 week had testosterone levels equivalent to men 10 to 15 years older than them. 1 week. Not years of bad sleep, 1 week. Number 3, visceral fat. The fat that wraps around your internal organs, not the fat under your skin, actively converts testosterone into estrogen via an enzyme called aromatase. The more visceral fat you carry, the more testosterone you lose, and the less hormonal support your erectile tissue gets. Number 4, chronic psychological stress. Elevated cortisol, your primary stress hormone, directly suppresses testosterone production at the level of the brain. This isn't a soft "stress is bad for you" statement. This is a hard biochemical pathway that your body cannot override. But here's where it gets really scary. These 4 factors don't work in isolation. They stack. And they create a feedback loop. Less sleep leads to more cortisol suppresses testosterone, low testosterone increases visceral fat accumulation, visceral fat lowers testosterone further. Most men are caught in this loop right now and have no idea. So you're paying attention now. Good. Let's talk about what actually happens in a proper clinical evaluation when morning erections decline. The first thing I do is separate psychogenic from organic causes. Psychogenic means the plumbing and the hormones are fine, but the brain, under stress or anxiety, is interfering with the signal. Organic means something physical is wrong, the blood vessels, the hormones, or the nerves. Here's a key clinical clue. If you still get morning erections even occasionally, but struggle with erections during sexual activity, that's often psychogenic. If morning erections are completely gone, that almost always points to an organic cause that needs medical evaluation. The standard workup I run includes total and free testosterone, luteinizing hormone, LH, prolactin, fasting glucose and HbA1c, lipid panel, and blood pressure. That covers the hormonal, metabolic, and cardiovascular causes in a single blood work panel. In some cases, I also order a penile Doppler ultrasound, which measures actual blood flow velocity into the penile arteries at rest and during stimulation. It's the gold standard for diagnosing vascular erectile dysfunction and gives us a direct window into arterial health. I want to share one more patient story. I'll call him Ray. 61 years old. He came in embarrassed, hadn't told his wife, hadn't told his GP. Morning erections, completely absent for about 3 years. His Doppler showed severely impaired arterial inflow. His testosterone was low normal. His fasting glucose was pre-diabetic. We addressed all three. Within 4 months, he had partial return of nocturnal erections. More importantly, his cardiologist found early-stage peripheral arterial disease and started him on appropriate management. Ray told me, "I almost didn't come in. I thought it was just part of getting old." And most doctors will never tell you this. The discomfort of bringing up this topic in a 15-minute appointment means millions of men never mention it, and doctors pressed for time don't always ask. You have to be the one to bring it up. The data is too important to leave on the table. Let's kill 2 myths right now because they're doing real damage. Most people think morning erections happen because of sexual dreams or arousal during sleep, but the truth is they are almost entirely neurological and hormonal in origin. They occur during REM sleep driven by the autonomic nervous system, not by sexual thought. They happen in male infants. They happen in men under anesthesia. Arousal has almost nothing to do with it. This myth matters because men dismiss the absence of morning erections as, "I just don't dream about that stuff anymore," when in reality, the cause is vascular, hormonal, or neurological. Most people also think that as long as they can achieve an erection during sexual activity, everything is fine anatomically, but the truth is that situational erections and nocturnal erections use partially different mechanisms. Situational erections can be maintained longer through psychological arousal, even as the vascular system begins to decline. Nocturnal erections are a purer measure of baseline vascular and hormonal health. You can still perform and quietly have the early stages of cardiovascular disease. All right, here is what you can actually do starting today. Step 1. Start tracking. For the next 2 weeks, keep a simple log. Every morning, yes or no, did you wake up with an erection? Partial counts. This is data. It's the same data I ask patients to collect. You cannot manage what you don't measure. Step 2. Protect your REM sleep aggressively. Cut alcohol at least 3 hours before bed. Aim for 7 to 9 hours of total sleep. Keep your room cool and dark. This single step can meaningfully improve nocturnal erection frequency within 2 to 4 weeks. Step 3. Get a metabolic and hormonal blood panel. Ask your doctor or a urologist for total testosterone, free testosterone, fasting glucose, HbA1c, lipid panel, and blood pressure. These 5 data points will tell you more about your long-term health trajectory than almost any other test available. Step 3 is the one most people skip, and it's the most important. Because without labs, you're guessing. With labs, you have a roadmap. Step 4. Address visceral fat with resistance training. Not cardio alone, resistance training specifically has been shown in multiple randomized controlled trials to increase testosterone levels, reduce visceral fat, and improve erectile function. 3 sessions per week, compound movements, progressive overload. That's it. Step 5. If morning erections are completely absent for more than 3 months, see a urologist. Not think about seeing a doctor. Actually go. Bring your log from step 1. Ask for the full workup. This could be the most important medical appointment you make in the next decade. Before I wrap up, there is one more thing about morning erections that almost nobody knows, and it genuinely surprised me when I first encountered this in the literature. The frequency and quality of nocturnal erections has been used as a predictor of successful recovery after prostate cancer treatment. Men who maintain or regain nocturnal erections after prostatectomy or radiation have significantly higher rates of functional recovery. The morning erection isn't just a diagnostic marker for problems, it's actually an active therapeutic signal. The tissue needs that regular blood flow to stay healthy, oxygenated, and responsive. In other words, using it, or more accurately, having it used naturally by your own body, is part of what keeps it working. Your body runs that maintenance cycle every night for a reason. The worst thing you can do is ignore the report it gives you every morning. Let's bring this home with 3 things I need you to remember. 1. Morning erections are a cardiovascular vital sign. A sharp decline or complete absence is a clinical signal, not a fact of aging, and it can predict heart disease years before any other symptom appears. 2. Low testosterone is vastly underdiagnosed, actively affects erectile tissue health, and is almost always treatable once identified through proper blood work. 3. The 4 lifestyle factors, evening alcohol, sleep deprivation, visceral fat, and chronic stress, stack on each other in a feedback loop that silently destroys your hormonal and vascular health. Breaking even one of them starts reversing the cycle. Subscribe, because I release new videos every week covering the things your doctor simply doesn't have time to explain in a standard appointment. And if this surprised you, you absolutely need to watch this video next.